Hey guys, welcome back to my channel. I'm Dr. Sylvia, a health educator and general practitioner with AskAwayHealth. In part 1 of this series, we looked at the natural birth control method known as the pull-out or withdrawal method, considering how safe and effective it is. We saw that while it is not as effective as the modern forms of birth control, it is better than using nothing and can be comparable to other natural methods like the rhythm or fertility awareness method, or even methods like the female condom. We also found out that apart from the risk of an unplanned pregnancy, in some cases you could be at risk of developing a sexually transmitted infection. And so using this method is not 100% harm-free. So in this video, we'll look at the benefits and disadvantages of the method. Make sure you stay to the end of the video where I'm going to share some tips on how you can make your pull-out game more effective. What are the advantages of the pull-out method? It might suit people who do not want to use other methods of birth control for religious, cultural, philosophical, and even health reasons. It's free and convenient, unlike pills and condoms or implants and coil devices. Of course, unlike some of the modern forms of birth control, there are absolutely no hormones involved. Next, you don't need a doctor to get a prescription or to attend a health center to get your shot or implant fitted. Compared to other forms, except probably the condom, there are almost no health risks, except for the possibility of a sexually transmitted infection if one or more of the partners are infected. It's actually better than using nothing, and some birth control specialists advise that using the withdrawal method in combination with other forms like the condom or the pill can deliver an effective birth control strategy. What are the disadvantages of using the withdrawal method?
Have you got a condom? I thought you were on the pill. No, it's not been good for me. I want you. I want you too. It'll be okay. I'll pull out and come outside. Are you sure you can do it? Yeah, we'll be okay, I promise. Yeah, baby. Can you feel me? Tell me what you like. Yeah, that's so good. Please don't stop. Yeah. Yes. Yes. Don't come inside. Please stop. Pull out. Yeah, wait, I'm coming. Yeah. What happened? Have you come? You promised. Oh no. I'm sorry. It's just too good, babe. Just too sweet. I didn't know when it happened.
Interesting drama going on there. So let's look at the possible downsides to this withdrawal method. As you heard in the drama, it takes a lot of control for the man to pull out or withdraw before ejaculation. And if you watched part 1, I asked you what you thought was the most likely reason that this method fails. And the reason is that the penis is not pulled out before ejaculation or coming, as is more popularly termed. Many people plan to pull out but end up forgetting or changing their minds in the heat of the moment. But the fact is, for this method to work, you have to pull out right at the moment where the pleasurable sex feelings are at the most intense, which many people aren't willing or able to do when it comes down to it. Pulling out also requires skill and the correct use every single time. What appears more common is that during sex, many men cannot withdraw immediately, and you should know that the first few drops of semen actually contain the largest amount of sperm. Considering that it only takes one sperm to fertilize an egg, using the method successfully means you need to do so correctly, pulling away before ejaculation and then ejaculating away from your partner's groin and upper thighs. The second reason is that the withdrawal method requires a lot of control, but the woman contributes very little towards it. So what I mean is that you need to be in a healthy relationship where both of you are equally committed to avoiding an unplanned pregnancy in order to use this method successfully. If it's you with the penis, you need to know when you're about to ejaculate and pull out before that every single time you have sex. You also need to be willing and able to move your penis away from your partner's vagina and their genitals and upper thigh area at the point where the feelings of pleasure are most intense. If you don't do that, your partner could get pregnant, and that's a lot of responsibility. And for you with the vagina, you need to trust that your partner will pull out his penis at the right time every single time you have sex. And if you're the type of person who doesn't usually cooperate with birth control and discussions around birth control, they may not pull out correctly, increasing your risk of falling pregnant when you didn't really plan to. The third reason is that the withdrawal method is especially not a birth control method for men who cannot control their ejaculation. For example, men who suffer from problems like premature ejaculation. Premature ejaculation is when you come or ejaculate before you're ready or before you realize it's about to happen. It's really common, particularly for younger men who are not sexually experienced, but it also means it's difficult for anyone who has the condition to use this method properly. If you want to learn more about premature ejaculation and its causes, make sure you check out this video here where I talk more about it. The fourth disadvantage of the withdrawal method is that as a man, you may feel that it takes away from sexual pleasure, making you unwilling to do it just to safeguard your partner's health or well-being. And the fifth reason is this issue of pre-ejaculate or pre-cum. Many people talk about pre-ejaculate, but actually when you look into it, there aren't lots of big studies on the effect of pre-ejaculate and pregnancy. Pre-ejaculate is the liquid lubricant released from the penis during sexual arousal, so that is before ejaculation. A few small studies have shown that some men carry sperm in their pre-ejaculate, but other men do not. And if there is sperm in this liquid, this method where we are recommending that men pull out before ejaculation will likely not work to prevent pregnancy. Most people recommend it's better to be cautious and behave as if there is definitely sperm in the pre-ejaculate, but we can definitely do with some more studies in the area. So now that you've heard the list of disadvantages, I'd like to hear back from you. Which of them do you think would cause the biggest burden for you using the pull-out method? And let's go back to the next segment. If you do decide the pull-out method is for you, what can you do to make sure that it's most effective when you use it? And number one, it's your technique. We've talked about this exhaustively, but one more time, if you're going to use this method, you need to make sure that you're pulling out at the right time every single time you have sex. Number two, if it's suitable, use the pull-out method with another form of birth control, like the condom or the pill. And number three, you and your partner can use the pull-out method in addition to spermicide. Spermicides are chemicals which can kill sperm. They come in different forms: foam, jellies, creams. Some of them can be inserted into the vagina before sexual intercourse and left for up to 6 hours to reduce the risk of live sperm traveling from the vagina into the womb. And tip number four, you have to be careful, particularly of your fertile or your partner's fertile period. This is that time in a woman's menstrual cycle when pregnancy is most likely. Particularly ensure that you do not rely on withdrawal alone on those days. Using an ovulation calendar is really useful for tracking those days. Number five, remember the issue with pre-cum or pre-ejaculate? Some birth control advisors recommend that guys go and pee before having intercourse to flush out any residual sperm within the penis, but please do not rely on this alone. And tip number six, be consistent if you're going to use the pull-out method. That means you have to do it every time you have sex. This helps you improve your game and your technique. And lastly, don't forget to ejaculate well away from your partner's groin and upper thighs. Make sure you comment below and let me know what you think about the pull-out method after this discussion. I want to know if it empowers you and makes you a lot more cautious or a lot more confident about using the method. If you like this video, make sure you give it a thumbs up and subscribe to my channel by clicking the button down below and the notification bell so that you know every time I publish a new video, which is once a week on Thursdays. And stay tuned for my next video, which is looking at the relationship between ovulation and your fertile window. While you wait for that video to go live, check out these two here, and I'll see you again soon. Stay well, guys.